morning. Thank you all for coming today. My name is Ellen Scholl, and I'm going to be kind of one of the moderators for today. This event is sponsored by the League of Women Voters. I'd like to introduce our president to you. Where'd she go? There she is, Nina Claire. The purpose of the League of Women Voters is to inform. So our purpose today is to give you information about what's going on in the legislature, in the community. We are taking no sides, and we just want to give you information. So I'm going to start out, I guess, by introducing our panel. We're very lucky that they joined us today. First time they introduced is Erin Hochfeld, sorry. And she is the co-coordinator with the Ohio Balance of State, where she supports housing programs in the 80 non-urban counties in the state. Her organization, COHIO, has been coordinating housing advocacy for over 30 years. So Erin's going to talk about housing today. And then we have Karen Wood. Sitting next to her, Karen was an attorney in the criminal justice system for 30 years. She's volunteered with food banks for over 20 years, including Seagate Food Bank in Toledo and the BG Christian Food Pantry in Bowling Green. In Toledo, she has spearheaded the project whereby a large community garden would grow for both themselves and food bank, resulting in over 800 pounds of produce being donated each summer. Since her retirement, she spends her time gardening, working on social justice issues, and fretting about the state of the world. So the next person I'm going to introduce is Lindsay Rudia. Yeah. There we go. And she serves as the Chief Executive Officer of the Wood County Health Center. Most of her professional career has been dedicated to working with federally qualified health centers, including past state and federal affairs positions in the Ohio Association of Community Health Centers and at the National Association of Community Health Centers. She's born and raised in Ohio. She told me Central Ohio. We'll forgive her. And after nearly 15 years in Washington State, Lindsay has relocated back to Ohio in the summer of 2024. She and her husband reside in Plain Township, Wood County. And I'm going to give David these before we forget. And last but certainly not least is Mr. Ben Robinson. Since September of 2020, Ben has MPH has served as the health commissioner for the Wood County Health Department. He has more than 15 years of experience in public health, the majority of which has been in preparedness and response, including 5 years leading planning and response efforts for the Ohio Department of Health. In 2007, he earned a master's in public health with a focus in administration from the Northwest Consortium of Public Health, a program jointly offered by Bowling Green and the University of Toledo. He has numerous public and professional engagements, including the following: current president of the Association of Ohio Health Commissioners, treasurer of the Public Health Services Council in Ohio, Wood County representative on the board of directors for the Area Office of Aging in Northwest Ohio, member of the Leadership Council of the Department of Health and Human Services for Bowling Green State University, chair of Preparedness Policy Advisory Group for the National Association of County and City Health Officials. Mr. Robson moved to Bowling Green as a third grader and has lived in Northeast Ohio most of his life. In 2007, he met his wife at a friend's wedding, which was held in Colorado. 51 weeks later, they have been married for 17 years and have 4 children. 3 girls and a boy, ranging from 5 to 14. He told us earlier that he doesn't think he's old enough to have 14 years old. And I quite agree, because he was my son's soccer coach. Don't go off. All right. So the person I neglected to introduce is David Ludendorff, who is going to take over and be the moderator.
Well, if you were here and saw Jerry Anderson, there's no comparison.
It's all right. Could you remind your microphone, please?
Sorry. My name is David Neuendorf. I'm here to try to act as a moderator, and you look like a rowdy crowd, so I know my job will be hard to do. A couple of notices first. We're at Peace Lutheran Church and offering, and this is from the minister, offering an open and free use of our facilities. One of the primary ways Peace announces and exemplifies Christ's generosity and community connection. Welcome on behalf of Pastor Dave. The bathrooms are back there. Occasionally you might need, anyway, it's back down that hall to the left side. The exits are there's an exit here, and if you get tired of listening to me, don't run too fast. Anyway, there's some ground rules. And so far, my job has been very easy. We're here to listen and to learn. And if you have questions to ask, anybody who has a question, we will let you ask it. If we can't get the answer, we're gonna keep track of it. And we're going to send these cards off to the appropriate person for the question. And I'll talk about that a little more later. Should we start with our first speaker?
Yes.
Good morning, my name is Ben Robinson, and I have the privilege of serving as the health commissioner here for Wood County. It was a privilege to come back to Wood County after a number of years away. I didn't when I left unexpectedly, and it was kind of when I returned unexpectedly as well, in the middle of the pandemic, and spent the first 5 months of pandemic response in the basement of the Emergency Management Agency in their operations center, about 7 days a week for most of those 5 months. And so when this job opened up, it was a chance to come back to community, and I wanted to have a chance to do that. So thank you for receiving me back so warmly, and it's been a pleasure to be here. As we look at what's happening in terms of changes in health and public health, right now there's a lot that is being discussed. There's much less that has been actually officially put into effect. And so I think there are certainly many open questions that we have. Aaron and I were talking just before and saying, we don't really know what we're going to see definitively yet. And I'm going to apologize in advance. You're probably going to ask me questions I'm not going to be able to answer. But what I can share is that as we're looking at the landscape, what we're hearing a lot more about than we've ever heard in the last 10 or 20 years is the transitioning away from sort of the focus on infectious diseases to a focus on chronic diseases. There is an opportunity then to take greater steps in prevention, which we in public health would welcome. Here's a bit of a statistic for you, but here in Ohio, every year, the medical costs alone of treating obesity range from $6.5 to $7.5 billion. 38% of Ohio adults are obese. And when you take all of that out and you apply that to increased medical costs, that's how you get that range. The federal investment in preventing obesity as a line item alone is only $500,000 a year for the entire state of Ohio. So we're not talking about pennies on the dollar, we're talking about fractions of pennies on the dollar. And this has been a pretty traditional thing. Generally speaking, when we have thought about chronic disease, we say we'll solve that problem in 30 years when it becomes a bigger deal. And we're essentially finding now that our bill has largely come due as a community. So we have opportunities to begin to battle back. Here in public health, we really feel like our job is to engage with the community in advance of their need for medical intervention. I was asked by someone earlier this week, what do you think about Ozempic and things like this? I said, well, once you've gotten there, you've crossed into the place where medicine needs to intervene in your health. Our hope is to get you to a place where that doesn't become necessary. So we welcome the transition to a greater focus on chronic disease. Our goal is to do that and to maintain some of the other gains we've had in other sectors as well, maintaining strong vaccination rates, which is important as we see measles begin to emerge across the country, including Ohio. Continuing to promote good use of data so we can make really smart decisions about how we promote and inform about how we can prevent disease that are acute diseases here within the community, and then really continue to do all the things that we've done well, help to keep our food and water safe, help to invest in nutrition for people who have difficulty obtaining nutritious food, to continue to promote health promotion efforts and even really expand those things. So that's really where we sit as of right now. We are both at the state and local level looking really closely at this and see opportunities for really making new strides. While at the same time we see really some importance of continuing to reinforce the things we've done over the last many decades. So I'll pause there and ask them.
What is a federally qualified health center?
Well, I will, I think that is a question better answered by my colleague at the end, so I will.
We're not going to ask questions until.
Okay.
So I'll hold that for Lindsay's answer, but that's just a quick opening statement.
Thank you.
All right, thank you. I am not as skilled with off the cuff remarks as my colleague over here, so I have some notes to keep myself on track as I share with you a little bit about the housing challenges in the current federal and state landscape. So I work for the Coalition on Homelessness and Housing in Ohio. We've been in place since 1994, coalition of organizations and individuals committed to ending homelessness and to promoting decent, safe, fair, affordable housing for all, with a focus on assisting low income and special needs populations. So it has been part of our work and an ongoing challenge to keep track of what's been going on with federal funding for the housing programs and projects that serve folks here in Ohio. Since the end of January, the current administration has issued executive orders that have attempted to cancel grants made to communities and organizations. But hopefully we all understand by now that executive orders are not laws. They are directions from the executive branch to agencies and departments. These grants have already been appropriated by Congress, and therefore restricting or canceling them legally requires an act of Congress. Multiple court orders from across the country, judges across the political spectrum have required that the administration reinstate and disperse these grants that it has tried to cancel because those funds have already been appropriated. So what I want to do is just highlight two major things that we're kind of keeping track of at the federal level. And I also want to just highlight something that I think everyone also needs to be aware of at the state level. The first is threats to the enforcement of fair housing laws. So in February, grants were unlawfully terminated to dozens of organizations that investigate discrimination complaints and educate the public about fair housing law. In March, the administration was ordered to reinstate 78 Fair Housing Initiative program grants. The National Fair Housing Alliance notes that fair housing organizations are on the front lines of efforts to combat housing discrimination through the enforcement of the Fair Housing Act. Without their efforts, survivors of sexual harassment in housing, veterans with disabilities requiring accessible housing, people of color seeking to buy a home free of racial harassment, and families with children would have no protection or anywhere to turn to uphold the law. The Fair Housing Act is something that we all need to keep an eye on. The other thing at the federal level that I wanted to highlight is the cuts to staff and the threats to the grants that the U.S. Department of Housing and Urban Development, or HUD, operates. They support more than 5 million households nationwide through programs offering assistance for renters with low and moderate incomes. HUD also provides vital funds for community serving infrastructure that's necessary to promote new development. So things like the tax credits that help to build new housing units. Losing these important roles means that grant funding takes longer to get to communities, and people with skills and knowledge about housing programs are no longer available to provide their expertise and oversight. There are over 387,000 people in Ohio who are supported by federal housing program dollars: veterans, seniors, children, families, and individuals with disabilities. And here in our congressional district, losing federal funding, which amounts to $74.2 million across multiple housing programs, would impact 11,111 households, 111 households of 20,376 people. So we want to really keep an eye on what's going on with the federal continuing care program through HUD. If federal funding for housing were to disappear, about 9 million people would fall into homelessness across the country. And I have a list of all the different, how much each congressional district is getting in their various federal programs, so you can review that later. State level. State level, we're really concerned about the Ohio Housing Trust Fund in the proposed budget for the new biennium. The Ohio Housing Trust Fund is the primary source of state funding for local homelessness and housing services that helps vulnerable Ohioans keep a roof over their heads. In the past, we have successfully advocated to increase the maximum annual allocation within the state budget to $65 million to support home repair and accessibility, modifications for low-income homeowners, rental housing development, homeless shelters, and supportive housing operations all throughout the state. Currently, we are really advocating for the Ohio Senate to remove an unvetted amendment that would gut the Ohio Housing Trust Fund by removing the current requirement for counties to send the Ohio Housing Trust Fund fee revenue to the state. So right now, our reporters collect fees. They send part of that to the state that goes into a pool, and it comes back to communities to support housing programs. It's distributed to organizations who are doing that. The change they're trying to make is to have each county keep their portion of the fees and then have to sort of create a new system whereby each of Ohio's 88 counties has to figure out how to manage that money. So instead of having one group managing, we're creating 88 new bureaucracies to figure out how to manage that. It doesn't, it keeps that funding dedicated to housing, but doesn't define what that means. So again, there would be some challenges to operating housing. And many of our agencies who do operate housing programs aren't single county agencies. They're often regionally based, covering multiple counties. For example, Great Lakes Community Action Partnership covers Wood, Sandusky, Ottawa, and Seneca counties for many of their housing programs. So that would then have to split. So it's a solution in search of a problem. And at this point, it is an amendment that the Ohio House has moved forward. So it's in the Ohio Senate's hands right now. So my encouragement to all of you today is to reach out to your senator and other senators on the Ohio Finance Committee to let them know that this seems like maybe not the most efficient and effective way to manage the Ohio Housing Trust Fund, which in 2024 helped provide emergency shelter for over 27,000 Ohioans, provided supportive housing programs to keep almost 2,700 formerly homeless households safely housed, and provided homeless prevention and rapid rehousing services for nearly 3,500 households. So again, a quick plea, we know that, you know, federal things are big splashy news, but oftentimes where we can have the most impact is in working with our state. So encourage everybody to keep an eye on that and make your voices heard at the state level as well. Thanks.
Thank you. I'm Karen Wood. I'm not employed by an agency like the rest here. I've been involved actually with food banks for 60 years because my parents were involved through Catholic Charities in Indiana. So I've been collecting food for the impoverished for almost my entire life. I have a disclaimer. I'm a member of the League of Women Voters, but I'm here speaking today as myself and not for the organization. So nothing that I say should impinge on their good name.
Me too.
And as I wrote this week, I kept going back to the Christmas Carol with Scrooge, where he says, "Are there no prisons? Are there no workhouses? Are they still in operation?" Because everything I'm going to say to you goes right back to what Scrooge said and the heartlessness of the heck with the impoverished and the food insecure. I'm supposed to be covering food bank cuts in this talk, but when I looked at the numbers and when I looked at what's happening in the US, I discovered cuts have been made to WIC, women and children, in eligibility, and that's they get formula and cheese and milk delivered to their homes. And monetarily, cuts have been made this week to Meals on Wheels, SNAP, which is food stamps, food banks, school meals, Head Start, and daycare centers, and all agencies that fund in one way or another the elderly, the young, and the impoverished. This month, the federal government cut $1 billion in programs for the food insecure, in just 2 programs, ended 2 pandemic era programs, 421 million for local food purchase programs, which will hurt farmers locally because that food was being bought locally from farmers who produce chicken and pork and vegetables. And they cut 660 million for local food for schools. This 600 million included food money for daycare centers and schools. They halted 500 million meant for food banks via USDA's Commodity Credit Corporation. 2 days ago, the New York Times headline was Trump cuts threaten agency running Meals on Wheels, a tiny division responsible for overseeing service to persons with disabilities and older Americans is being dismantled as part of the overhaul by Health Secretary Kennedy. 2 million older Americans receive Meals on Wheels a year. The March 31st headline in the Toledo Blade noted Seagate Food Bank, which services Wood County and 8 other counties, had $655,000 worth of food canceled. They lost 19 trucks of food from May to July this year. That was eggs, milk, chicken, pork. 4 million has been cut so far in food banks nationwide. School meals are on the chopping block. 36 million kids get free meals in this country. Around 18 million people were food insecure in 2023, according to the USDA. That's the last time they had figures. Other agencies believe it's closer to 47 individuals are food insecure in the US. WIC, which is food for women and children, still safe in theory, but the eligibility restrictions are planned for Medicaid, which when you don't want to say you're going to cut food for new babies, you just cut who's eligible for that, and therefore you make cuts to the program, diabolical. WIC serves 6.6 million each month, which, get this, is 39% of all infants in the USA. We're in worse shape than we think we are, frankly, my personal opinion. The Ag Department, which oversees SNAP or food stamps, was ordered to cut 230 million. Government plans to cut 1.1 trillion in aid to Medicaid and SNAP over 10 years. 42 million people get food stamps in the US. That's 12% of all Americans. The state government of Ohio has cut 15 million for food banks on April 1st. The irony there, April 1st. The governor could have vetoed it, but he did not. 3.4 million Ohioans qualify for food stamps. Keep in mind, we only have 10 million residents in the state, and 3.4 million are poor enough to get food stamps. So it's more than a quarter of our population. Let me get a little opinionated here. So, the House.
I'm glad you're restraining yourself.
Everybody knows me knows I've never restrained myself when it comes to opinions on social injustice. The House Finance Chair Brian Stewart said food banks aren't getting their full funding request in this budget for Ohio. He said, we have 4% unemployment in the state. We have a huge list of open jobs available to people to go fill. I hope people do. We think that should drive the demand for food banks down. Let them go to the prisons and the workhouses. A study cited by the Ohio Association of Food Banks last August showed 49% of households using food banks had no member who was employed. Of those who were unemployed, 58% said they were too sick or disabled to work. 43% said they were retired. 57% of people who go to food banks are not receiving SNAP. So it's not like people are double dipping or trying every single program they can. They're going to get what they need. I volunteer at a food bank, and I feel like that's a privilege and an honor. And when we have a system where, in order to keep your dignity and to make you feel good about getting food, it serves kind of like a Kroger, and you come in and you shop on these shelves, fill your cart, which is a shopping cart like from Kroger, and we help you take it out to your car. It's just like going to the store. And almost every time I help someone take their food to their car, they have this need, and I don't ask, I never ask any questions. I'm just ask their first name, I'm nice. and not because they always tell me why they came to the bank to get food. And majority of people, the story starts with, I got hurt at work or I got hurt somewhere else and I didn't have health insurance. And that starts the spiral to doom for these people, or they say, my daughter was a drug addict and now I have 3 grandkids to raise and I'm 80 years old. Or my car died and I couldn't get to work anymore and I don't have the money. I mean, it's there before the grace of God go I. This could happen to any of us. It's all luck of a draw, what family we're born into or what the luck is as we age through life. And I'm always struck by the need for them to tell me, I'm not a deadbeat, I'm not a slacker, I'm not a loser, I'm not a grifter. I really need this food and here's why. And I have more to say, but I don't think I can say it.
Thank you. Well, good morning. I'm here to speak about Wood County Community Health Center. I'm happy to try to answer questions as best as I can about health centers, healthcare service delivery system, and I also want to talk about Medicaid today. So just a little bit about our community health center. I'll be happy to answer in a few moments about what is a federally qualified health center. But we are a federally qualified health center. We provide medical, dental, behavioral health, and pharmacy services to our patients. We do what we call a whole person model integrated primary care services. So we take all ages, all insurance types. So we do take private insurance as well as Medicaid, Medicare, veterans insurance. And we offer a sliding fee discount schedule if somebody is uninsured or underinsured. So even if somebody has health insurance, if they're not able to afford their out-of-pocket costs, we can offer a sliding fee discount program. We have a fantastic staff at our community health center. I really like to make sure the community knows that we exist. So we are located in the health department building off of East Gypsy Lane Road. We are open to everyone. Probably one of the top questions that I get is, do you have to be a Wood County resident? And the answer is no. So we will serve anyone and everyone. We do have people from outside of our county coming here to Bowling Green to access healthcare services. As has been touched on a little bit here, so there is a lot going on right now at both the state and federal levels. And just to give you an idea of timelines of when we will know answers to some questions. So at the state level, we should have our state budget by the end of June. So we are actively in that state legislative process right now. And then at the federal level, I do anticipate we'll start hearing Congress talking about Medicaid more in May. So we'll start seeing some information there in the month of May. And then the Congress is working towards developing what will be the federal fiscal year 2026 budget. The goal would be to have that complete by the end of September, so September 30th. Now, as you all are probably very familiar, Congress does not always meet that budget deadline. But we would expect between now and September is where we will be hearing Congress debating and making decisions, what programs are included in the budget and at what funding levels. For our program as a community health center, we do receive federal funding. So we have a federal grant that we use, and that is specifically to help us to provide access to healthcare services for individuals who are below 200% of the federal poverty level. But the Medicaid program is also really important to us and really important to our patients. So I'm happy to speak about that today, but I will say at the federal level, we will be watching to see what happens. But Medicaid really is a state and federal partnership. So we're also watching to see what happens at the state level. So it was in the governor's budget, some language that is about the federal match. So the federal government puts some money into the Medicaid program and the state puts some money in. And the amount of money varies depending on what's called the category of individuals who are being served. So high level, there's roughly 3 categories in the Medicaid program here in Ohio. So you have age, blind, and disabled, I'm gonna get the acronym, so the covered families and children, so children who would qualify for Medicaid, as well as their caregivers and pregnant women. And then you have the adult population. And for each of those different groups, there's different poverty levels, that is what qualifies them to participate in the Medicaid program. But also the match is a little bit different, so how much money is the state putting in versus the federal government? So right now, there was language in the governor's budget, and it has currently continued on in the House version, where they're looking at if there would be a trigger. So something changes on the federal side as far as how much money is the federal government putting in specifically for what's called the expansion population. So that is adults up to 138% of the federal poverty level. Right now, that match is a 90-10. The federal government is paying 90% of the costs. Our state is paying 10%. If that match were to go below 90%, the state could eliminate that program, which would mean there'd be fewer people who have health insurance coverage. So that is one thing we're monitoring at the state level, is to see how is that language, does it make it through both the House and Senate versions? Are there any changes to that language? And then at the federal level, watching to see how does the federal government decide to continue funding the Medicaid program. So there is a lot to be paying attention to right now, and thank you for this opportunity to be here today.
So thank you all for what you said, and before we go any further, I want you to know that we did invite other people to come who were unable. So I have a statement from Alicia Nanadovich, who is the director of the Student Senior Center, and she said, "Thank you for the opportunity to share today. The Wood County Committee on Aging would like to affirm that at this time, we are not facing any funding cuts to our programs or services. We would like to assure you that there are no plans for cuts at this time to any services. Our commitment to serving the older adults of our community remains strong, and we continue to provide vital programs such as home delivered meals, transportation, caregiver support, programming, and wellness services without any interruption. However, we are closely monitoring the administration's proposed fiscal year for 2026 and their budget and for the U.S. Department of Health and Human Services, which includes significant reductions and eliminations to key programs under the Older Americans Act. While these proposed changes have not yet affected our local funding, they pose a serious threat to the long-term vitality of aging services across the country. Should these federal cuts come to pass and impact our operations in the future, we will actively seek additional funding sources to avoid service disruptions. The well-being of our older adults is the highest priority, and we are committed to doing everything in our power to obtain a program that they can rely on. I share this with you today, not out of alarm, but out of transparency and a desire for a partnership. Your advocacy, awareness, and support are vital as we work together to ensure older adults in our community continue to thrive. We also contacted Social Security, and Social Security told us that they no longer have a communications bureau. It was cut, so they weren't able to come today. But they did want you to know that if you call the local office, you will get someone to answer the phone and relatively quickly. And I can attest to that. I've called multiple times for different reasons for my family. And within 2 minutes, I was on the phone with somebody. And I even got calls back on information that I had missed. So they are very good here about keeping in touch with us.
They said, do not call the 800 number, call the local office. And segueing there, we invited Teresa Gavarone today. And what I got, we didn't just call once, we emailed police about David, apologies for not giving you an answer sooner. Sadly, Senator Gavarone will not be able to attend this event. Please feel free to send us any relative information stemming from this discussion, believe you will. And I would be happy to share it with Senator Gavarone. That was the senator. Here's another invitation to around, we invited the public schools here. You know, there's something on the village. Thank you for this invitation. Unfortunately, both BG Bowling Green Community Schools Treasurer Matt Fiesel and myself are out of town that day. we do appreciate the opportunity, wish we were available. What we're trying to do here is let you know that we did our yeoman's job to try to get people here. Michael Penrod, thanks for reaching out.
He's here. He's in the audience.
Private citizen.
Well, he said he wasn't gonna be here. You wanna come up and address?
I have really nothing to say.
Okay,
We're in the middle of a lot.
well, anyway,
You can share what I said at the public record.
don't cut libraries. And I'll put this out on the table, there's a handout here that I produced for people that are interested. The library is one of the most important institutions we have in Bowling Green, it needs to be protected. We asked Marcy Kaplan to come here because some of her Northern County she represents. She's not here. I'm notorious for sending things to our representatives regularly. And I always get back things from Bernie Marino, it's always the same statement. You know, I'm interested, I care. We have a problem with something called the SAVE Act. I tried to have somebody here today to talk about that. That's an act that affects over half our population, since over half our population is female. They're trying to take away your right to vote by making you register. They already did that. It was called by the way, anything I say does not represent the way women voters. Because I'm like Karen, I'm even more opinionated. But the SAVE Act is trying to say that you have to have a proper documentation. Now, they created this, it was called a real ID, where you had to prove who you were to get it. Now they're saying that's not good enough, you have to keep going. And if for example, if registered, they put my name down as Dave Neuendorf rather than David Neuendorf, they could say, well, you can't vote, can't prove who you are. But the men don't have to worry about it, the females. We had a woman at the Taft event a couple weeks ago, father who stood up and said, my daughter's getting married. I said, don't change your name. Because it's gonna create difficulty in your life, you're not gonna be able to vote. We contacted WVGU, PBS. They want you to save public funding for public television, radio. But thank you so much for offering to include WVGU, PBS in this important panel discussion. Sorry for the late reply. Somehow we missed your earlier email. Unfortunately, we have other commitments this weekend and are unable to attend. I'm going to say something. This is my opinion. There are a lot of afraid people out there. There are a lot of institutions that are afraid. There are law firms that are afraid that will give money to certain parties because they're afraid. And I don't know if this is my opinion, if they're afraid or this is just a fact that when you stand up now, whether you're, even if you're a judge, you can be prosecuted. I contacted the Veterans Service Commission of Wood County. And said, I don't, say this first one, I don't have a good, they said, I'm sorry that you'll be unable to participate. My apologies, as I see, I didn't reply to your email on the 16th. Isn't that funny? Nobody listens to me. It's like being at home. Unfortunately, I think our staff aren't able to participate at this on the 26th. I said, well, who can you send? And he says, I don't have a good recommendation for another participant. And there's not a lot that's unknown at this time about why they already know something, that they're way out veterans, workers, people who work with veterans, they know that. Anyway, so the point I'm making here is that the League of Women Voters put this event on. We are blessed with having the people who showed up here. And we do appreciate your being here. But you need to know that all those letters you write to the BG Independent, the Sentinel Tribune, the Blade, whoever you can, and even sending letters to Ladd's office. I'm sure they don't read them. I know they don't read all the letters I send. But it goes into a checkoff. Opposed, in favor, opposed, in favor. And someday, when our Congress, Democrat and Republican gets courage back, they'll be able to vote again. But you need to be proactive, because I'm an old guy. But my grandkids' future is on the line, and so we need to be active and proactive, which is one reason that the League of Women Voters allowed us to put this presentation on today.
So you have some questions? that-
Yes, we have questions.
And then we'll let the audience.
Yeah, we'll let everybody else come up and talk. Okay, what is a federally qualified health center? Okay.
So federally qualified health centers, you will also hear them commonly referred to as FQHCs or community health centers. This is a federal designation, and it's actually really hard to get that federal designation. It is a very highly competitive grant process, and that grant is not open every year. You have to wait for Congress to appropriate funding specifically for that purpose. I say that because we're very fortunate here in Bowling Green that we have a community health center here in our community. There are a number of federal program requirements that we have to follow as a community health center, so I already shared a couple earlier on. Another really unique one for an FQHC is that over 51% of our board of directors are required to be patients of the health center. So really making sure that the patient voice is overseeing our efforts, and participating in things like strategic planning. So here in Bowling Green, because we are part of the health department, we have what's considered a co-applicant board, so the health center has a board of directors, and then we have, of course, the board of health as well, so they're working in collaboration. Nationally, health centers serve over 32 million people. About 50% of health center patients have Medicaid as their insurance coverage. This is our nation's largest system of primary care. So each health center is its own independent entity, not for profit, but collectively, they're forming this large primary care system for our whole country. Same here in Ohio. So in Ohio, there are 60 different community health center organizations operating about 500 sites. And it is our state's largest system of primary care. I'm very passionate about community health centers. I think it's really important that we are providing access to primary care services because our focus is prevention. There is a lot of data and research on community health centers because we are required to report a standard set of data to the federal government each year. And that's a good thing because then you can research and see what are we doing. And we are a very good use of federal funding. Health centers statistically serve sicker patients. So our patients are usually about 35% more likely to have chronic conditions. But even though we're serving a sicker patient population, we are able to demonstrate better health outcomes as well as cost savings as compared to private providers. So that is a really great thing to be proud of and to celebrate about the health center program.
Okay. Sorry about that. Medicaid spending totaled $880 billion in the federal fiscal year 2023. With the federal government paying 69%, $606 billion, and states paying 31%, $274 billion. What are some opportunities to achieve cost savings? Anybody want that?
So just to put this in perspective, here in Ohio, more than 1 out of every 4 individuals in Ohio have Medicaid as their insurance coverage. So we hear about Medicaid, or we've heard a lot lately this year about the Medicaid program and what are some ways to save funding, because there's a lot of state and federal dollars going into the Medicaid program. When I think of Medicaid, and of course I'm looking from this as the lens of a healthcare organization, our patients' insurance coverage is very important for our patients. I see Medicaid as a really important component of economic development, of making sure that people have health insurance coverage. A couple of years ago, CMS at the federal level, Center for Medicare and Medicaid Services, they put forward a goal that by 2030, every Medicare and Medicaid contract would be value-based care. What is value-based care? What does that mean? So historically, when a patient goes to a doctor, you bill the insurance, you just get paid a set amount for seeing that patient, right? Our country has been moving towards value-based care for really the past decade. And this is the concept of instead of just paying me for seeing a patient, they want to pay us based on the outcomes. So if a patient comes to my community health center, are we actually helping them to improve their health care? Are we helping them to control diabetes or hypertension? So this is happening not just with private insurance programs like Medicare or Medicaid, you're seeing it in private insurance as well. And so it makes sense, right? We want to not just be paying for people to access care, but we actually want to see them improving their health outcomes. So when we look at the Medicaid program and specifically community health centers, so helping people to get engaged in primary care, establish a relationship with a provider, we actually can see that the health center program is saving the Medicaid program billions of dollars. So yes, there is money going in, but what is the return on that investment? The return is that we have a healthier population, that we're helping people to be able to get back to work. There's lots of really good things that are coming out of this. So value-based care is one way. As a community health center, so the community health centers here in Ohio back in 2017 formed what's called a clinically integrated network. And so all of our health centers are looking at our Medicaid data and patient outcomes on a very regular basis. I have multiple calls that I'm on every single month. I can look at our data as a health center. I can see all the other health centers' data. Very excited to share our health center is actually really leading in the state when we look at our quality metrics. We're doing really, really well. So this is something we've been working on with our Medicaid insurance contracts, and then recently added one specifically for Medicare. So how are we doing value-based care with our Medicare contracts? So that's something that has been going on for a while, but you're going to see more and more of that coming. I'll say another way that you can save money through the Medicaid program is continuing the Medicaid program. Because when people lose health insurance, there's a huge impact to their lives, to our economy, really. So thinking of it as part of workforce development, economic development. Medicaid expansion is attributed, and this is data I encourage you can look at Health Policy Institute of Ohio. They have really good data analyzing Medicaid in our state and public policy. And so we can see that when Medicaid expansion happened back in 2014, we saw a big decline in the uninsured rate in our state. And I'll tell you that historically, if somebody does not have health insurance, they do not access the healthcare system, or by the time they do come to the healthcare system, we're usually very, very sick. I'll give you an example that happened at my health center just very, very recently, is we had a patient come in who had been without health insurance. So yes, this patient could have come to our health center. We have our SLIDE program. We can and do see patients who are uninsured. But again, statistically, if somebody doesn't have health insurance, they just don't use the health system very much until they get really sick. So this patient came in, she had been without health insurance, but recently got coverage again. So she's starting to use it. She knows what it's like to be without health insurance, has it again, so now she wants to use the healthcare system. This patient called our health center 13 times over a 2-week period. And it's because they had gone without care for so long, they were now to the point where they had so much pent-up demand, multiple co-occurring medical and behavioral health needs, that they needed a lot of extra support. And so now we have put together a special support plan just for this patient who's going to need additional care that maybe they would not have needed if they had sustained regular access to the healthcare system. So that's just a few kind of stats about Medicaid and really the role it does play in ensuring people have access to care.
If you're running for office, I'll vote for you. We need people at the state level and national level who know what they're talking about. Thank you. Did you wanna up on that question too, or not?
What I can add is similar to what Lindsay said, there's value in prevention for public health initiatives as well. When you look at the range of return on investment for public health initiatives, the range is between $8 and $14. For what we see in terms of the median to average range of public health programming. So what that means is that if you spend $1 on public health activities, you expect to get between $8 and $14 of return, and that can show up in a number of different avenues. It can show up as increased productivity within your community because you're not having to take time off of work. It can show up as reduced medical costs. It can show up as reduced administrative burden because we're not having to track this process through the system. And we know that when people are left without resources, as Lindsay says, something that could be treated simply with an antibiotic can become something that now leads to hospitalization. And a single case of hospitalization is remarkably more expensive than many cases of antibiotics being prescribed. So from our perspective in public health, it's really two parts. It is trying to identify the opportunities to prevent as much disease as we can, to increase access to individuals who need some medical intervention, and to do so at a time when it is the most cost effective to do so. This was from grad school, which, you know, as I shared, I told my 14-year-old daughter, I don't know who your parents are because your mom and I aren't old enough to have a 14-year-old. So this is a long time ago. But in grad school, we talked about a community that had taken a different approach to addressing the impacts of obesity within their community. And traditionally, what will happen is when a health department or a community wants to make an impact, they look at the population level overall, and say, how much are we spending on the costs for obesity? What is the indirect cost of lost productivity? And then we tend to do something most of the time. We focus in on the individuals who are the greatest at risk for heart disease or stroke, the most likely to take time off of work. And then we pour money and resources and time into addressing those individuals. Well, this community said, we're gonna try something different. If our goal on the public health side of things, right, not the medical side, the public health side of things is to turn the tide and sort of shift the outcomes for the population level. We're not going to focus on the sickest. They divide their population into quintiles, and they left the two most at-risk quintiles for the medical community. They said, this is not our role. Our role is to deal with those that are slightly below average in terms of their activity, average or above average. And we're going to try to move them from where they are just one step up in the continuum. So if they are average, you want them to have above average activity. If they're above average, you want them to have top level activity, and so on and so forth. This community did this, and what they found was they had greater outcomes at the population level than ever had before. And so when we think about this trade-off between public health and medicine, that's the divide. Our role in public health is to engage the community when they don't need medical intervention to turn their health in the right direction. Medicine steps in and community health centers step in where that intervention is needed. So if you take something like diabetes, public health has a role in preventing type 2 diabetes from ever occurring in the first place. Community health centers have a role in effectively controlling diabetes once it is experienced. Both of those things keep costs down and allow us the opportunity to keep our community healthier. So it's a collaboration between medicine and public health that prevents as much disease as we can, staves off the need for medical intervention, and hopes that if we do things well, that when intervention is required, that is a lower level, less impactful intervention that is not only less costly, but allows people to get back on their feet.
Thank you very much. I got a question for Karen now. In view of the budget cuts at both the state and federal levels for food banks, what can the average citizen do to alleviate the strain on the local food system for the needy?
Glad you asked.
Because I was called to.
First of all, I'm so grateful that these three work for us.
Yes.
Because we are so fortunate to have them in our community doing what they do. I learned so much from listening to the three of you. One of the most important things you can do right now, and we made this easy for you, the League of Women Voters did, is write to your legislators. We have these out in the hallway, if you can grab one when you leave. It makes it really easy to figure out who your senator is, who your state senator is, your federal senator. It's all in here. And if there's an issue that I talked about that you care about, whether it's WIC or food stamps or Meals on Wheels, all you have to do is go Google for the latest article, which there are many, on say Meals on Wheels, which got proposed cuts this week. Write to your person saying, I'm opposed to this. It's so important. And if you plant a garden, plant an extra row or two, and then take that produce to a food bank locally. I can tell you, people eat it. You might think, no, they want Cheetos, but our vegetables and fruits go so quickly at the food bank that I donate to and work at, particularly the foreign students at BGSU. They have a diet in their home countries that's much more fruit and vegetable oriented, and that's the first thing that they look for is fresh fruit and vegetables. Every time you go to the store, pick up an extra tuna or peanut butter, because the things that are being cut from food banks are eggs, chicken, pork, milk, cheese. So we're gonna have a dire lack of protein in this country in this summer. So pick up a tuna, peanut butter, something in that area. And if you can run it to a food bank, or there's a national food drive on May 10th, leave it by your mailbox in a bag and your mailman will take it and take it to a food bank. So that would be easy in the next 2 weeks. I have found that every food pantry has basics like rice and beans and generic mac and cheese. But there are foods that the food insecure folks really want and they can't afford, and it makes such a huge difference to their lives whenever you donate things like pickles, olives, Band-Aids. I've had people cry before because we had Band-Aids at our food bank. I've had people cry before, particularly mothers from Cocoon, when we had birthday cake candles or sprinkles for cupcakes. Literally cried, which then makes me cry. We always need black hair care products. Kids' toothbrushes are a big need. We have so many people ask for those. And something people really like that they can't afford are fancy salad dressings or fancy barbecue sauces. They make people so happy. What we really need are adult diapers and feminine hygiene products. And even though you don't think about it when you donate to a food bank, cat food, dog food, and 5-pound bags of kitty litter. There are so many hungry cats and dogs in this town. I see posted every day on social media. I don't get paid for a week. My cat has no food. Can anyone give me a bag? That breaks my heart. Finally, BG schools are always looking for monies to help pay for kids' school lunches and for Bobcat basics. So if you only have 10 bucks, write a check for $10, drop it off at the Bowling Green Schools office on 12th Street in Maine, and $10 will make a big deal to some kid to help pay for their school lunches. And Bobcat Basics, where they cover things like snacks for after school, school supplies, sweats, tennis shoes for kids that don't have tennis shoes. I noticed there's a sign out on the bulletin board in this very lobby that tells you all about Bobcat Basics, and that will tell you whatever you need to know right out there on the bulletin board. Thank you.
In your opinion, is it possible that local companies or corporations could step in to cover deficit in funding?
Well, I don't have a crystal ball, but I kind of think we're gonna have a recession this year, which is going to cut down on corporations donating for things like this. That's just my opinion, but I can't see how we aren't going to have a recession. And we already have wonderful organizations locally like Panera and Starbucks, Osama Cookies, Kroger, but a lot of the foods that they give us, God bless them, are cookies and cakes and all sugar oriented things or white bread. So that comes back to us donating really good foods like vegetables, fruits, and tuna and peanut butter. So I'm hopeful corporations will step up. We can't rely upon them. We have to do what we can do individually, I think.
Could we, is there somebody here who would like to step up here and ask a question? Please feel, just come on up, you can line up behind, and we're gonna keep track of these questions and then try to pass them on to the appropriate
Well, I just have a quick follow-up question about like food banks and donating and things, and I feel like I maybe have heard that rather than like going to the grocery store and buying extra things and giving you the things, that money donations to food banks can actually help the more you spend more effectively. Can you speak to money versus actual food items?
That is true, and every single food bank will tell you that, because they, for instance, with Meyer, every year they give us $4,000. If we raise 4,000, they would give us $4,000 and turn it into $8,000 worth of food. So we go there and shop. But there's a real propensity for the directors of food banks to look at the rice and the beans and the things, the basics, and not look at the things that people really want and never get. I mean, you know, pickles are $5. If you don't have $5, you don't have pickles the whole year. And it's, to me, it's the little things that make people so happy when they come to see us. So yes, give money to food banks because then they can get things in bulk and get more bigger bang for the buck. But there's also things that make people so happy, like the birthday candles, that I find I do both things because I know how happy people are, particularly mothers, when they get things they never get.
It's a both and, not an either or.
Yes, exactly.
I don't have questions. I actually work with some of these lovely people. My name is Sabra Destano. I'm the director of 211. We serve with Lucas Ottawa counties. We also serve other counties in Northwest Ohio. If anyone doesn't know what 211 is, we are a free, confidential, 24/7 helpline that connects people to resources like food, medicine, housing, utility assistance. The problem is that nothing's left. We're often the first call that people call when they're in a problem, and we're their last call when they're in crisis. We know that, you know, when Ben got cut $8 million for transportation for COVID, or our part of that was transportation, supposed to be transportation for COVID, you know, it takes a chunk out of the resources that we're able to provide. I've worked with Erin for a long time, and while she does great things for the whole balance of state, I work a lot in Lucas County where I know that the family waiting list for shelter is 140 people or 140 families right now, which the last time I calculated out was about 3.75 people per family. So you're looking at hundreds of people who are precariously or literally homeless in Lucas County. The problem is that there's no room in shelter because everybody in shelter is waiting for housing that isn't available. The housing problems are, the problem is that we were already so low on resources. And I get a lot of times, well, there aren't resources, why should people call 211? Well, what 211 has right now is data. And we have public facing data. If you go onto our website at 211nwo.org, you can scroll down and it says data info. I clicked off of it. It's you can scroll down and you can find our data. And we have when you click onto the public facing dashboard, the first thing that you'll notice, because the first thing that comes out is housing, is that we collect unmet needs. So when people call 211 and we're unable to meet the need that they're asking for, which is a lot lately, we are collecting that data and then we're problem solving with them. We're saying, what is it that you need? You know, we know car insurance. There's never been an agency that will help to pay for car insurance. Ohio, you have to have car insurance to drive your car. So if you don't have money to pay car insurance, and it's kind of like medical, it's the prevention. We're not putting money into the places that we can get away with not paying money into. So if I get into a car accident and I'm uninsured, now I have the bills from that and it piles up and then they don't get medical and then the housing goes. And it is such a slippery slope. So, I do encourage you to go onto our dashboard. If you are writing, to your legislators, please use data. We know that data is the thing that is going to help us to at least be able to say, this is actually what's going on and not anecdotally what's going on. Anybody can use this data, anybody who wants to get more information on the data that we collect, I would be happy to provide that. But the bottom line is that 211 can't connect people to resources that don't exist. If shelters are full, if libraries are closed, if we have no places for people to go during the day, it's going to get worse. We are seeing encampments rise in Lucas County at an alarming rate. And if anybody thinks that Wood County is not right there behind it, you're not looking. Because we do have literally homeless individuals living in Bowling Green, and it's gonna get worse. It's gonna get infinitely worse if we don't use this information to all be able to talk about it. But I do think that one of the things that you had said about some of the people who couldn't come, it did hurt my heart a little bit. I will say that I'm a little on nobody talks bad about nonprofits in my presence, because we're all at and maxed in capacity. Myself, my staff, my frontline staff members, getting call after call after call after call where people don't need what used to be available. Oh, I can send you to Salvation Army, they can give you $400 and everything goes back to normal. People need 6 months, a year, they need so much to dig them out of the place that we have put them in society. It's gonna take a lot, it's gonna take everybody together, but don't ignore what you're seeing, collaborate is my thing. Like, we've got ways, we've put great work into place to put infrastructure in, especially through COVID, with a lot of these agencies. And so the more we come together, the better it is.
Thank you. That's good.
I am a patient of the community health center, so, and I love it. Thank you for taking Medicare. I have a question related to Medicaid. It's very specific. About 10 or 12 years ago, the state of Ohio decided to close many of the developmental centers for people with severe disabilities from childhood. They moved many of those individuals into the communities using Medicaid waivers. So my question is, do we have any information yet about the potential impact of Medicaid, the reduction in funds on people in Ohio who are receiving Medicaid waivers so they can live in the community? And I know that it's a small portion of the Medicaid population. What you mentioned, I think before, blind, aged, disabled. So it's a small portion. But without those Medicaid waivers, these individuals will, I don't know where to go. So that's my question. People with severe, significant disabilities.
Yes.
So I don't know if I can speak directly to that because I personally have not heard any specific conversation about that part of Medicaid being cut. So age blind and disabled, I was just looking at the data recently. I want to say, if you looked at the entire Medicaid population, only 17% fall in that category, but that category is almost 50% of the total Medicaid cost. The potential things that I have heard, so for sure, there's conversation about what's called the expansion group. So the expansion is not age blind and disabled, this is adults up to 138% of the federal poverty level. So that group, to my knowledge, is probably most at risk of potentially losing Medicaid coverage. Another thing the state is looking at implementing that you will be hearing in the news is work requirements. They're talking about that at the federal level as well, but Ohio specifically is looking at implementing that. But if you look at the language, it specifically would exclude individuals, with disabilities. Another thing to watch for would be if the federal government were to block grants of Medicaid funds. So right now, there's these matches, right? The state's putting in a portion, the federal government has put in a portion. That is something that the federal government could decide to do if they're trying to achieve the savings at the federal level, then shifts the burden really to the state level. So if our state was given just a lump sum of dollars and told, okay, use this to fund your Medicaid program, well, how much money is that? Is it able to cover everyone who is currently covered under the program? So I think those are the things I would be watching for.
Thank you.
My question is a little bit off topic, but I'm very concerned about the SAFE Act. And I'm wondering if it would be a good idea for women to take their birth certificate that shows their birth name to along with them when they go to vote. Because I know that that's something that the Trump administration is looking at.
To respond to that, the problem is this: if you're a woman who never got married, it's easy with the birth certificate. If you got married, then your birth certificate name is not the same as your married name. And if you're Elizabeth Taylor, she got married about 7 times and 1 time to the same guy. So think about the convoluted documentation it would be. This is a criminal act on the part of politicians to do this. I think taking your birth certificate would not be a bad idea. But that doesn't guarantee that you're gonna get the vote, because if that name is different than the name on the register, see, that's the problem. Why should all women have to go re-register to vote every year? It's. I can't answer your question any better than that, but it has gotten through the Congress, through the House, but it's in the Senate now. So writing to Mr. Houston and Mr. Marino and say, just ask the question, how do we do this? How is this gonna work? And the fact is they have a federal law that said,
Register the vote now.
Not every single time.
No, just the one.
Okay.
Just when you register, it's not when you.
you're right,
Okay.
but if you're ready, the name you have now, if they say prove that you're this person, yeah, so.
There's a presentation today at 2:00 here on this very subject.
Oh, okay.
Debbie Dahlke is giving a speech on this very subject for the community, so today at 2:00,
lunch.
right here. Right here.
Yeah, that could be a real problem for women who have changed their name or who haven't changed their name. It's anything to keep women from voting.
Well, the feds are working on one and our state is working on one comparable. So no matter where you come from, they'll find you on this. So come today at 2:00 and Debbie Dahlke, who knows more about it than anybody in Bowling Green, will be here.
Okay, thank you.
Does somebody else want to come up and speak? Come on up.
People I want to talk to. I have an experience I want to share that I recently had with the Social Security office. First of the year, I changed my bank account and I wanted to set up a new direct deposit. So I go out and the wait time was very reasonable. And the young lady that helped me was, she was very polite, she was very efficient. And you could just tell she loved her job and she loved helping people. So when she got through, she said, "Is there anything else I can help you with?" And I said, "Has anyone told you today that you do a beautiful job?" "What do you think?" she said. "No." And I said, "Well, let me be the first one to tell you that." And she lit up and you could just tell that she so much appreciated the compliment. And I think it's so important that when we interact with people who serve us, that we make sure and tell them how much we appreciate it. I mean, these people don't know from one day to the next that they're gonna be there. And maybe these compliments will encourage them to stay. So thank you.
Thank you. Anybody else?
I just wondered, given what could be coming ahead, are there any contingency plans that your organizations are, I mean, I have a son who's in a company that might get cut, and they are working on contingency plans, and I'm wondering, that's the private sector, I'm wondering, how the public sector can do that?
I'm happy to start. The short answer is yes, at multiple levels. As we are looking at all of these funding streams, we're beginning to ask the question, more than anything else, what are the essential functions that we need to perform within each of the things that we do? I was on kind of heard some of my involvements. I was on a meeting yesterday talking about a funding formula for a particular grant that Ohio receives. That is shared with the state health department, and our organization defines how the local portion of that gets distributed to local health departments and what we do with that. We were having a really robust discussion yesterday to ask the question, that grant, I'm probably sharing more than each, but that grant has, since its inception in 2002, has actually reduced in value by about 75%. So we're quite a ways away from where we started, and with inflation and other things like that, it's we've had to wrestle with how we do this, right? Independent of any cuts. And what we're doing is we're asking questions within this field, this particular discipline of what we do. What are the most important things to accomplish? And what's the cost to accomplish those things? And we're beginning to do that across the board, ask the question of what essentially gets the biggest bang for the buck, and what's the value of that. We are conducting right now in the health department a comprehensive top to bottom review of our funding sources. We have some programs, so not many, but some programs that are fee based. So we're ensuring that our fees are covering our costs. And if they're not, trying to identify opportunities for savings and taking those up over time. We continue to explore opportunities for additional revenue generation, like approaching foundations or granting agencies. Both public and private, to try to generate more revenue. In my time at the health department, which has been about 4.5 years, we actually brought into Wood County and kept more than $10 million of additional grant funding. Our annual budget is about $10 million, a little more than that. So that's been really transformative money for Wood County, and we want to continue that. So we're looking at every side of it. So the short answer is what are the most important things that we need to do? A. B, what are the opportunities for reducing costs where we can, without disrupting those core functions? And then C, what are our opportunities for additional revenue generation across the board to not only preserve the things that are core to us, but also think about expanding into new areas that we don't really do. People have asked me before, how much do you do with nutrition and health education? And I say, not much. And part of the reason that we don't is that that's not where the money has been. So health departments have largely had to have programming follow available resources. But we know that those things really generate great savings within the community. So as we're looking at that, that's something we'd love to generate dollars to do investment in, because again, as we shared earlier, there's a great return on investment. I was looking up something and I wanted to remind myself of what it was. But Indiana did some really great advocacy on the value of public health and reducing costs. And in terms of what makes us healthy, they did some research that found that public health initiatives, not medical, public health initiatives account for 70% of what makes us healthy. But when you look at where the spending is, it's overwhelmingly spent on clinical care. And again, we can't eliminate one or the other. A community that can't respond to heart attacks is not going to do well. Now there's a community that has way more heart attacks than they should, right? So it is a both and investment. But when we work together well, we have opportunities to drive down some of these costs. I think that that's part of what we're thinking about is it's not just about contingency planning in the near term. It's also studying a long-term view to say how do we take advantage of opportunities that exist As I shared earlier, I am actually really encouraged by shifting focus to chronic disease. If this generates additional revenue at the local level, at the state level, we may have an opportunity to make a real dent in some things that drive a lot of cost, a lot of lost productivity, a lot of additional cost to businesses in terms of hiring employees. And a lot of additional costs when you visit the doctor, visit the hospital. So I think there are some things there that are real opportunities, but it's a long-term plan, short-term plan. And the reality is that we understand the core work and we'll preserve that first, and then work to try to retain everything we can and expand where we have opportunity.
So I'm not a direct service provider, so but my job is 100% federally funded. So, you know, the continuum of care program was cut at the federal level. I will see me doing something else. I'll keep myself busy. But I would say what I would say about the majority of the programs that are funded to do emergency housing and rental assistance through the federal COC program through HUD in Ohio, if they did not receive that funding, they would not be able to continue operating. There just aren't a lot of other dollars that are available to do that kind of work. So, you know, foundations aren't gonna step in and replace that money, corporations aren't gonna step in and replace that money. You know, those are public dollars for public good, and they don't exist other places. So I think, you know, if we were to see substantial cuts to funding that comes through the continuum of care program, that you would just not see assistance available there. And folks who are calling Sandra, there will be even fewer things for her to refer to.
I think one of the responsibilities and duties of a decent government is to provide for those who can't provide for themselves, whether it's food or healthcare or whatever, and we're failing in that. And I think that if we could be getting more money from corporations right now or from the community, we would have been doing that. But we relied so much on the federal government and for state government that when that's cut and it goes away, it's gonna be hard to fill a gap of millions of dollars for food for 50 states. So I went to the food bank when I volunteer at, when I saw what was happening a couple weeks ago, and I talked to someone on the board and said, what are we going to do? When the article came out late about Seagate Food Bank being cut millions, which helps fund us down in Bowling Green. And she said, God will provide. And so I started thinking, maybe I need to look at some other alternatives. Not that I'm dissing God here or anything, but I think it's going to rely upon people like you in the community who will buy us 50 cans of tuna in 1 year. Or it's going to rely upon churches, which frankly, churches aren't growing in the United States except for mega churches. So it's going to be churches like Shars and mine that has 40 families that we do amazing work on just 40 families, supporting the community when it comes to food and other projects. We are going to have to hit up corporations more, but I think that if they wanted to be giving to us, they would already be giving to us. And so we'll hit them up, but I'm not hopeful. And there are foundations, but with everything that's happening with housing and medical and food, foundations are going to be hit big time, like Toledo Foundation and Bowling Green Foundation. Everyone's going to be asking them for money. So those are my ideas. It's going to be us, really, who save us.
Yeah, real quick. So for the community health center program, if you look at our federal funding, well, the dollar amount has not gone down. In comparison or in relation to inflation over the past decade, we've actually seen a 27% decline. So we're already doing more with less. Hopefully every organization, you know, is being wise and thoughtful of what are we doing with our funds. We're always looking for operational efficiencies. I'm always looking at our various contracts, for example, for interpretation services. Are we getting the best rate we possibly can? We do group purchasing opportunities, making sure we're getting discounts on our medical supplies. there's only so much more you can do with less. This past fall, the Health Center Board and the Board of Health approved us purchasing portable dental equipment so that we could do school-based dental services. This program came about because of our school nurses here in Wood County. They came to us and said they were seeing significant need amongst their student population who just were not getting access to dental treatment. So we have gone out and purchased, made the investment, purchased this equipment. We're now able to go out into the schools and provide dental services, which is awesome. It's meeting a direct need in our community. But if you look at our dental patients at our community health center, 70% are insured through Medicaid. So that's a very important insurance coverage for our patient population. So there certainly is concern if people were to lose their health insurance. So we actually had the opportunity to have Congressman Lana visit us at the health department recently. He got to meet with my chief dental officer, Dr. Uthmani, and got to see this equipment that we purchased for the schools. And he was very interested in understanding these programs that we're implementing in our community. And so I think it's important to be educating all of our elected officials, going to Columbus, meet with our state legislators so they understand what are these services that we're providing? What are the funding sources that we're using and who benefits from the programs?
I just want to add one more thing, and I should have said this when I first spoke, but here in Ohio, we are funded differently in health departments than many other states. About 72% of all the funding that health departments have is local funding. Only a very small portion of what we get in Ohio comes from the state GRF. And only about 16% of across the state of all local health departments budgets are federal funding. So while we're watching this and seeing what's happening both at the federal and state level, we are not as directly impacted as someone like Aaron's program would be, but that's one part of it. The other part of it is that we didn't start contingency planning now. Our Board of Health has put in place emergency revenue funding 3 years ago. That is available to us should we have a really substantial disruption to our funding streams that would allow us to identify over a couple of years, not require us to do something in a couple of months. And so as you look across Wood County, we have really responsible organizations. I look at some of my colleagues here in the audience who aren't waiting for the weather to get bad before we start trying to fill our bathtubs with water to hunker down for 3 days. We maintain a pantry that has water already in it so that we can weather these storms. And so we are in a place where we have the resource available because we've had a responsible Board of Health. Looking at folks nodding who have other responsible boards who have put steps in place to allow us to continue to serve our community effectively should we see a disruption, so that we've got to figure it out over years and not over weeks or months. And so as someone mentioned the loss of funding we saw, part of the reason that you haven't seen me, my board, I said to my board, I'm disappointed but not stressed. And part of the reason that I said that and I was able to say that was we use those dollars wisely. We invested them in one-time opportunities. Disappointing we couldn't do that.
Absolutely.
But it didn't have an existential threat to the agency as a result of that. And so we are in a position to weather storms should we see them, even as we continue to do additional contingency planning.
And stronger in partnerships, because we've put in the work. You know, I have been doing this work for 11 years at 211 and nonprofit my entire adult life, and I've never seen the nonprofit sector so poised to do the work. We just need the resources to do the work. We can't do the work without the resources.
Can I say one more thing, I promise, and that is, when you look at these cuts, you think, well, that's just food, or that's just housing, or that's just Meals on Wheels, and that doesn't concern me because I don't get Meals on Wheels. I have a friend who delivered for Meals on Wheels for 15 years, and in that time, she found 3 dead senior citizens when she would go to their homes to give them their meals. If it had not been for that program, who would have found them when their families lived out of state? Think about the small things that are involved in everything that we're talking about here. She would find people who were feeling ill and didn't want to tell their families, so she would call their families and say, hey, your mom's not doing well, you need to get back to Ohio, to Wood County to deal with this as a friend, not as part of area office on aging. She, just because she cared about the people she gave food to every day. So when you think about all these cuts, it's death by 1,000 cuts. There's so many things involved, all these facets that you don't think about, but just on Wheels, who's gonna find the people who died in their homes? Because Meals on Wheels doesn't come anymore.
Okay, this is, in my opinion, it's not an official League of Women Voters opinion. But the real problem is that we had a president who said this week, we're not gonna